Welcome to the Wellness on Tap podcast with your host, Dr. Debs Eastwood.
Okay. Take three. Woohoo!
We need a clapperboard.
That's it. Yeah, we'll get one. And pretend Mark's a clapperboard when he just claps at the beginning. But so when we were chatting at that festival recently.
The Wellness Way Festival.
The Wellness Way Festival. Wasn't that wonderful? The setting.
At Wasing Park, it's just beautiful, isn't it?
I couldn't believe it.
Honestly, I just thought it was a beautiful setting.
Yeah.
Wonderful people.
Yeah.
It was just a nice size, wasn't it?
Yes.
And gosh, there was so much, amazing speakers there,
Yeah.
so much going on.
Yeah. And the
really,
weather.
I mean, it was the best I've been to. And actually, somebody said that to me, that contacted PHA through the website and said, literally, it's the best holistic event I've been to. It was
so
really
friendly,
good.
wasn't it? And so chill and just so comfortable.
Yes. You could leave your bag lying around and,
didn't matter, did it?
honestly,
Yeah.
community.
Community. Whee!
We'll come back to that one.
We will come back to that one because that's where it's all at, isn't it? So you
Yeah.
just mentioned an acronym there, PHA.
Oh, yes.
People's Health Alliance.
Yes,
Yeah?
correct.
So I want you to tell me, if you would be kind enough, more about the birth of the People's Health Alliance and what it does and what it's all about, its aims, its vision.
Yes. Okay. So we launched 23rd of April 2022. So we're now 3.5 years old. And it really began, I guess, when a certain pandemic began, in terms of people just realising that things weren't quite stacking up. But at the same time as it progressed and, people were being isolated, locked down, etc., we could see that mental well-being issues were really escalating, etc. It became more and more apparent to a small number of us who eventually found each other in December, around the end of 2021, that the NHS wasn't able to support everything that was happening with people. And so we needed to come together and set up safety nets to catch people. And the vision, I guess, was to create a network of hubs that could support a fully integrative approach to healthcare across the UK. And with that, to provide resources to empower people to take back control of their own health. And really, it's about looking for root cause solutions rather than sticking a Band-Aid, to coin an American phrase, on a problem. But ultimately, we want people to be well and to stay well, don't we? So it's also about prevention. So, we like to say at PHA, we collaborate, we facilitate, and we educate. So we have over 3.5 years, a growing bank of educational resources whereby we can introduce people to alternative therapies, all backed by science. Of course, research is important. We wouldn't talk about anything that we didn't research well ourselves, and would expect everybody to do their own research. That's what life is about, isn't it? I think we were talking before and talking about being a critical thinker or a free thinker, and we collaborate with some amazing organisations doing wonderful stuff, but who just don't have the voice. Amazing individuals doing amazing things that just are healing people, but they don't have the voice. So I like to think we give people that platform and we signpost people to them through our practitioner directory, through our community hub directory. So when we did launch in April 22, it was after a few months of working together, really, to build the website, build the vision, bring people on board, very much a grassroots organisation, people-led, volunteer-led, you know, and it's for the people, by the people at the end of the day. So we don't own anything. We pull these things together and welcome people in because it's for all of us. But very quickly, it was amazing. We had an interview with Pam Gregory 3 months after we launched, and that was it. It just took off overnight, literally, as I was on holiday in Turkey and ended up spending most of the week in my hotel room responding to emails from all around. And you're kind of saying, oh, you know, shaking your head, go, oh, you're on holiday. But it was the best. It was the best week ever because we knew at that point that the vision was shared by so many people around the world, and that something so simple was exactly what people need and people wanted. So answering all those emails, we now have PHA in Australia, New Zealand, North America, which incorporates Canada and Mexico, in Spain, Portugal, Slovenia, Malta. You know, so there's amazing people. I keep saying amazing, but I am constantly amazed by the people that I've connected with over the last 3.5 years. But they're all doing wonderful stuff, but they're all doing it in their communities and inspiring others to come together and do the same. So it's wonderful to be a part of. Like I say, I've met some phenomenal people and learned so much myself as an individual. I mean, I'm an accountant by profession, and it was only through my own healing journey that I realised the path that I should be on, which I think a lot of this tends to be the case, doesn't it, with a lot of therapists that I talk to. You know, they've had their own healing journey, successful journeys, and then they want to share that with others and help them to find what they need.
Absolutely, definitely, yeah. And it's interesting when you were saying about, you know, free thought being allowed, because we are pushed from birth, aren't we?
Yes.
Down a particular route.
Yes.
A route that, you know, we are registered at birth. We are in the system. Mm-hmm. You know, we then go to school, which has a curriculum where we get taught certain things defined by the system. And free thinking and individuality isn't what is required at the end of that journey, is it? It's somebody who can tick the boxes and go and work in a job and, you know, get a mortgage, have 2.2 kids, get married, registered again. And then at the end of the day, when you check out, that's registered too. And it's just all channeled in one way.
Yes.
And free thought is like not part of that equation. You're considered alternative. You're considered woo-woo. You're considered weird. Mm-hmm. Not so much nowadays. I think it's becoming more and more accepted, but there's still huge.
I think terminology, language is key, isn't it, with everything. So, you know, energy healing. Do you refer to the science, to the quantum physics, or do you call it woo-woo so that you can, what's the word I'm looking for? So you can undermine it and you all, it's like the phrase conspiracy theorists. You know, we know who coined that phrase first. It was the CIA, wasn't it? So, you know, throw that kind of doubt by your terminology and suddenly you've lost all credibility. So what we do is we showcase this amazing work that people are doing, the different modalities, and back it with the science, and hopefully just give people a different outlook on things. and encourage them to explore and question and research. I think those three things are just so important.
Yeah, they're
aren't
fundamental, aren't they?
Otherwise, trot along and go about your day job and register, and then pop your clogs and game over.
That's it. And I mean, if that's what you want to do, fine, go ahead and do it.
And everyone's on their own path. I appreciate that. I appreciate we're all different, but we should all have a choice.
Yes.
But
100%.
if we don't know there's a choice, we can't make one.
Absolutely, which is where the education comes in, isn't it? It's about giving people the knowledge and the awareness, and especially at a local level, that choice is available. And the giving people a voice really is the nub for me of why we are sitting here today doing a podcast, because my vision, very similar to what you've just described, and I'm like, you have demonstrated there's lots of people all over the world that had the same vision because they're already doing the same sort of things, which is just fabulous. But for me, it was when my little brother was sick.
Yeah.
And he was on an intensive care unit in a central London hospital. And he was sick and as far progressed and ended up passing, not because he had COVID, because he didn't. He passed because of COVID.
Yeah.
And because of the way that was run in this country, and it meant you just could not get access to medical services, which was at the time what he needed. And so his disease process had got so far down the line by the time he actually got access that even though the bone marrow cancer, the multiple myeloma that he had, was completely reversed in terms of looking at it numerically, the markers for that were sky high, and they went down to almost zero with the treatments. But the damage that multiple myeloma had done, specifically to his heart and his kidneys and other organs as well, but those two primarily, was irreversible. And that, in the end, was what took his life. Now, I will never have any evidence to be able to back up the fact that had he got that treatment a year before, when he first started knocking on the door, but common sense says if that disease hadn't been so embedded, it potentially may have left him with some illness, but not to the level that it was going to take his life. And it was when he was in that state in this central London hospital and I saw these tumour markers go down to nothing, I thought, okay, good. What about him? What about him? What about him as a person? Nothing is being done within this system. And in some cases, and as you know, I'm a medic, I've worked in intensive care units. So it's not something I'm talking about in an abstract way. There was nothing to do with him. So that's when I started looking more into the alternative world. I mean, prior to that, I knew about various alternative therapies, for instance, homeopathy, just to name one. I knew that existed, but obviously I didn't know much about it because I'd never researched it fully. But as an intelligent woman, I was looking out there on the internet and finding all these modalities that I'd never even heard of. And in one breath, I'm like, yeah, this is wonderful. But in the next breath is, well, what is that all about? Is it relevant to him and his circumstances? And is the person doing it any good?
Yeah.
And I had no barometer to gauge any of that. And I wanted to then create the thing that you've created, which is the practitioner database, so that people coming there are credible and can be promoted and marketed to the best, to give the best for the people at the receiving end. And so that was why, after all this research and then, unfortunately, he passed. And I just thought, I have to do something.
Mm.
And that was my thought.
Because unfortunately, he was one of many.
Yes, wasn't he? Many.
So many.
Yeah.
And we cannot and must not ever let that happen again.
No.
Which is why we need to shift that paradigm of healthcare.
Yeah.
Empower people to take back control.
Yeah.
Give them the tools, give them the education, and make communities well again.
Oh, please, yeah.
To stay well.
Yeah.
And to teach their children and their children. That's how we're going to make a change.
Yeah.
Is by doing it together.
Exactly. And like you with your cause, that's why the podcast exists, to give the healers a voice. But you do more things. I mean, I'm hoping I'm chucking a bit of education in there as well, but you actually have a specific section to make sure that happens, that I think is amazing.
Thank you. I mean, it's interesting, isn't it? I mean, we started, in April 2022. What we've evolved into, and it continues to evolve, is all down to the people that get involved. So being volunteer-led, supporting and learning from amazing practitioners, highlighting and spotlighting what they're doing, signposting to them. This is all what the evolution of PHA and the future of healthcare is about. But we need everybody to do it together.
We do.
Because, there's some amazing stuff going on, but there's a bit over there and there's a bit over there. And somebody here is doing this, which I can only talk to so many people and bring them in to this shared goal. Because I think for a long time, because practitioners weren't heard or given a platform, they've gone into their corner of the world and carried on doing wonderful things, but not reaching the people that they need to reach.
How did the PHA help to get the practitioners' voices out there then? So
by joining the practitioner directory, we do regular social media spotlights. We have a weekly newsletter that goes out where we interview. We do lots of interviews with practitioners to talk about their modality. We invite them to add resources to our library to help educate people. We have a monthly workshop for practitioners solely for them to help them in their business, to broaden their audience, to grab that voice that they've got and shout it from the rooftops. There's SEO engagement and all that techie stuff I don't get involved in, but it's good. We're always developing and adding to the website, the PHA website, so that it's showing up on people's searches. So there's a lot of amazing benefits to joining that practitioner directory. And that's it. It's about just showcasing them and getting them out there and making sure that people in their locality can find, credible practitioners that are affordable.
Very important.
It's always been very important to PHA that we create a service that is affordable for all. It's not always possible, and there's different therapies that are obviously there's a scale, isn't there, of things, but there's always something that people can do to improve their health. So affordability has to be addressed at every point, because good health shouldn't be a privilege. It's a birthright.
Yes.
We all deserve it. We all are born, being entitled to that. So let's work together and make it affordable for all. We can't have people slipping through the net.
No. So the PHA supports different practitioners in their local communities.
Yeah.
How?
So some practitioners have come together, created community hubs. They're supported by us by joining the practitioner directory, where we can actually signpost people to them. We've just launched at the Wellness Way Festival a community action initiative called Connect the Dots. And what that is about is having a dot on every village, town and city across the UK, a dot representing a community hub. Now, it may be a health hub, it may be a National Residents Association. The importance is that people are coming together in support of each other, in service to each other, whether you're a practitioner or a plumber or, we've all got skills. Maybe you're great at admin, but there's a place for everybody, isn't there, within a community?
Yes, there is.
So bringing people together to support each other, to break down those deliberate divisions that have been forced on society for a long time now, to protect and help the most vulnerable, to really support children growing up and arming them with the skills, the life skills they need to prevent disease, to stay well. To learn about, to collaborate with the farmers, to understand that our environment and our food source is what keeps us well. It's all a big equation, isn't it? It's actually quite a simple equation. I know it's not a big equation, it's simple.
Yeah. Big as in wide-ranging.
Absolutely. But yes, I mean, it's important that people understand this and understand that they have a choice. And to provide the resources to understand what those choices are, but most importantly, take responsibility for them. You take responsibility, you're more likely to achieve whatever the end goal is. And I just think it's important that we recognise that despite all the division, we're all fighting a common enemy. And the only way to win is to come together and do it together.
Yeah. So
and that's what Connect the Dots is about. How
many of these hubs do you envision?
Oh, well, there's 8,000 villages, towns and cities in the UK. So I think, if we get a dot on the map for each one of those, then we're looking pretty good there. And everybody's got somewhere to go. Now, there's already a lot of stuff going on out there. So if we can start by getting those existing hubs onto our community directory, then people can find you. So if you are listening and you are part of a community group, get on there and let's signpost you so that other people can find you. Underpinning those community hubs, we really want to see practitioners supporting them. And so if we had 8,000 dots on the map, let's say we aim for quite easily 40,000 practitioners on that directory. I think that's doable. Yeah. We currently have 1,000. So again, call to action. Let's get practitioners onto that directory. Let's signpost people to you. They need your help. They're out there. They're suffering. They're lonely. They're isolated. They need help. Connect the Dots is about inspiring people to come together in their communities. So if there isn't a community group in your locality, we want to inspire you to just take that first step. And the first step is really that thought in your head that actually things aren't quite right. People don't talk anymore. There's people suffering. and I want to make a difference. So we can help you do that by going to the website and having a look at Connect the Dots. We've created a discovery pack which will help people get started. There's downloadable resources such as posters, flyers, etc. Social media templates, set up a Facebook group. And people can do this in lots of different ways. There's loads of ideas. We can also connect you with community champions, organisations that are already doing it out there and having real boots on the ground impact in their community. Organisations like the National Residents Association, like the Conversation Starter Project, which launched in lockdown, I think the first lockdown, to bring people back together, go for walks in nature, really help people with their mental health, to start talking again. I don't know if you've ever heard of, and I only came across this last week, but there is a sociologist called Ray Oldenburg. Now, in 1989, he wrote a book called The Great Good Place. And he coined a phrase, the third place. And what the third place is first is home, second is work, and third place is where you go to meet people, socialise, feel like you belong, be part of something. It's all about fostering community support, community spirit, not being isolated. So third place is really important. And third places have been diminishing for the last few decades, as you can imagine, more urbanisation, people working from home. COVID had a huge impact on third places. Financially, businesses going bust, lockdowns, etc. People working from home, not wanting to go back to the workplace afterwards. Pubs, cafes closing down on the high street as we move to retail parks, etc. So for a long time, third places have really been battered and been disappearing, which has meant that people are more and more isolated. Yeah. So Connect the Dots is all about those third places, bringing them back, supporting our high street shops and, going back away from the big supermarkets that actually are not giving you the food that you need to be well. Third places. So this is actually hot off the press now, Debs.
Excellent.
We like a bit of hot off the press,
I love
don't
an
we?
exclusive.
But I'm also committing now myself
to
to this, committing PHA to this, committing Connect the Dots. We have claimed 3rd of December, and that is the third being third places, which is why we've chosen 3rd of December as the UK's National Community Day.
How wonderful.
Did you know one doesn't exist, to my knowledge? I couldn't find one anyway when I had a look. So we're having it. So on the 3rd of December, we have the UK's first National Community Day. And that day is about coming together in our communities. But we're going to do it ourselves first. So me, Lisa, I'm going out into my community that day. I'm going to take some of my downloadable flyers. I'm going to talk to people. I'm going to talk to shop owners. I'm going to engage them in what we're doing and inspire them. And that's the way we do it. So let's practice what we preach. Let's get out there. Let's show people how it's done. And let's celebrate the people that are already doing it and have been doing it for a long time and doing it successfully, but showing others how it's done. I've already chatted to our international PHA family. Next year, it's International Community Day.
Love it.
Maybe the year after, it'll be International Community Week. we think big. We do it because we know it's the right thing to do. And it's what we all need to do. It's the only way we're going to change the world.
Yeah, because how many people struggle with loneliness per se anyway?
Yeah.
That was exacerbated so much more during COVID.
Well, I wanted to squeeze National Community Day into 2025. I think it's really important that we jump on this straight away. And 3rd of December, it works for the third places.
Yeah.
But it's also December, which is really, we enter the season of goodwill. People are already getting together, etc. But the flip side of that is that those that are isolated, vulnerable, lonely, are feeling it even more at that time of the year. And it's so important that we all rally and support those people.
Very much so.
So I think it's the ideal time to do this, and I'm really excited. So as I say, it's hot off the press. It was just in my head about 3 days ago. So
wow, thank you for sharing that here then.
But we're all jumping on it now, and we're going to make this happen. And it'll grow. But the important thing is, if just one community group springs up out of there, then it's worth doing, isn't it?
Yeah.
But it won't be. I know it'll be much more than that.
It will be. I can feel it too.
Yeah, because you're going to do yours in
of course I am.
Your area. So
that's it.
Too.
Sheffield, here we come.
Absolutely. So yeah, it's exciting stuff.
Yeah.
We continue to evolve.
Yeah.
Yeah.
Which at the end of the day, from what you were saying earlier, tying the community into the initial thoughts that you had about PHA was about empowering people, educating people, and therefore, and letting them know about alternatives that are out there. Because most people growing up within the system think that is the only way of doing things. But that's not the case, is it?
No.
People do have a choice.
It's the choice, isn't it? It's the choice. But if you don't know that you have a choice, how can you make one?
Exactly. Effectively, you haven't got one.
No. And that's what they don't want you to know. So that's what we're here for, to talk about those choices. And that's fine. If you'd rather queue for an hour on the phone trying to get a GP's appointment, and it's fine. Everybody has that choice to do that. But know that that's not the only way. And actually, root cause is where you should always be striving for. Actually, being well is what you're striving for.
Yeah, and should disease occur, then find why.
Find the root cause.
Yeah.
Absolutely. And I think it's important when we talk about choice to understand that you must always, if COVID taught us anything, is that you have bodily autonomy, and protecting that is so important. And we've actually got I don't know if I've talked to you about this before, Debs, but we've actually got an amazing PHA partner called My Medical Choice. And they don't like me saying this, but I do think it's such a great insurance policy. If you were for example, if you were in a car crash and unable to speak for yourself, you may not be able to reject certain medical interventions. That is really something that's really important to you. Through My Medical Choice, you can set up an advanced decision notice to help you to set out your wishes should there be an emergency where you can't speak for yourself.
Yeah.
And this service will also notify your emergency contacts should something happen. So for me, when it launched, actually, it came out of a Stand in the Park group back in the lockdowns. And, when I first saw it, pretty much as soon as they launched, I stumbled across it and thought, thank God somebody's thought about this. And this is it, isn't it? This is why there's lots of different people doing wonderful stuff, but unless we come together, we can't share about it and, lead people to the things that they need and are asking for. So I found My Medical Choice in 2021, just after they launched. And I just thought, this is amazing. This gives me such peace of mind that my personal wishes to protect my bodily autonomy are going to be respected should I not be able to speak for myself. So, yeah, I mean, things like that are just vital, aren't they? As we move through this into what is the world that we're all trying to create for our children, on future generations.
Yeah. I mean, as a medic, some things that really irritate me, and one of them is the do not attempt CPR notification. They now called it a respect form. It's all the same thing. It's basically, if my heart stops, I have made the decision, or a clinician has made the decision, if you don't have the capacity to make it yourself, that, it would be absolutely futile and pointless. Because I've either seen directly or heard of instances where families have come in that situation and completely kicked off. And you've got your poor, old, frail, person who had said, I don't want this. And the family's overriding it because they no longer have the capacity. And this poor, old, frail person ends up with their heart restarted to be put on a ventilator in ITU.
Yeah, exactly.
For the rest, which is short period of time. For what?
Yeah. And it really is a minefield. The whole thing is a minefield, isn't it? I lost my mum to Alzheimer's, and we went through that whole journey. And it's not until you find yourself in that position that you're saying, I don't even know where to start with this. Where do I go? Now, this was 10 years ago. Well, it was a long journey, but it started about 10 years ago. And there was nothing anywhere to go to for guidance and, to understand not just the legal, but the whole process of dealing with councils and, funding and all of this kind of stuff. So PHA are pulling together care packs for people that are facing these very difficult times of life, both as an individual, but also as a family member that's dealing with it. But I think My Medical Choice really helps to protect the individual and their wishes in that respect, because, I ended up with lasting power of attorney, both financial, but also health and, healthcare, and did uphold my mum's wishes of a DNR.
Which is not an easy thing.
It's not an easy thing because, we don't want to lose the people that we love.
Of course.
It's not an easy thing. And I will say, so, but with My Medical Choice, the advanced decision notice really does protect those wishes rather than a lasting power of attorney, which it shifts the responsibility to
somebody else.
Yeah. To somebody else. But it is a minefield. So I think that these are things that just help navigate. It's not easy, I'll tell you now. It's not easy doing your own advanced decision notice. But what My Medical Choice have done really well is they've tried to think about just about everything that you might want to consider. You may not be bothered about blood transfusions, so it doesn't matter.
Yeah.
But you may be.
Absolutely.
So they provide education on blood alternatives. It's there on the ADN to be used or not, but actually going through that process and thinking about, do I want to donate my organs? Mm-hmm. Would I take plasma products. You know, would I be okay with vaccines, which are very topical? You know, things like that. But they're not easy questions to answer sometimes, especially if you've got children.
Yes.
You know, and you want to be there for them in all situations. And anyway, we're kind of going, that's probably another podcast. But so apologies for going down this route. But it all comes back to choice, doesn't it?
It absolutely does.
And education.
Yeah. Because if you've gone to the trouble of educating somebody and empowering them, and then in literally the last moments of their life, the decisions that they have made for themselves, hopefully with, you know, discussion with nearest and dearest. So there are no surprises. I mean, I know, you know, if it's something that happens like that, there isn't the opportunity for that. Hopefully, My Medical Choice says, you've got the ability to think about all of these now that you've been empowered by PHA and all the resources that they have. And you can then sit down with your family, your nearest and dearest, whoever they may be, and say, right, I'm educated on this. This is what I've said. Open a discussion. If you've got any objections, let's hear it.
But respect my choice.
Yeah. Let's get it out of the way now, because I need to know that you're going to respect my wishes at the end of the day.
It's an interesting point and a very good point that you've raised, because people do create advanced decision notices and forget to tell people, their family members, and go through that. So, of course, it can be a huge shock.
Yeah.
And they don't understand the reasons behind the choices that have been made.
That's so important.
Yeah.
So important. I mean, my cousin's done something, and I'm going to talk to her about the My Medical Choice, and she's in Sydney. But, you know, she's told me, she goes, my kids know where my will is. They know what I want. They know what I don't want.
Yeah.
All my financial documents are in there, you know, and the passwords and everything else. That's been her approach, to be completely open about it.
Yeah.
And, you know, when she eventually does pass, it's still not going to be easy for the family, of course not. But a lot of the decision making that can be so heart-rending,
absolutely,
has been taken out of it, which I think has the potential to smooth a traumatic and upsetting process in some small way.
Absolutely. And, you know, I mean, it's even things like on the, by signing up as a member, you can put all of your, it's up to you how much medical history, medications, allergies, etc. Which, if it's an emergency, you know, you'll know the golden hour.
Yes.
If it's an emergency situation, for a paramedic to be able to access that information immediately,
Vital.
can prevent any medical error, etc. And, you know, what's needed can be done.
Yeah.
What's excluded because of the ADN can be done and avoided. And you hopefully make it through that golden hour.
Absolutely. It's like I say to all the medical students that come through me for training, if a patient has had an operation, so when they come to me as an anaesthetist, they're going to be having an operation. And if they've come to that electively and not as an emergency, they have to fill in the hospital I work at, a specific document. There will be something similar in all the hospitals. And I say to them, if you meet this person for the first time when you are a junior doctor and your mental capacity is already quite full, wouldn't it be nice to have a nice summary of what their main problems are and then have that broken down system by system? That's what an anaesthetic chart for a pre-assessment for an operation does. On the one in Barnsley Hospital where I work, it even says right on the top of it, under the patient identifiers, significant problems. It's the same thing as you're saying, but it takes a lot more to know that a person's had an operation, especially if in an emergency situation they're not communicating with you. You can't do that. And the medical choice document takes it to that step where you don't need to have that inquiry.
It does.
But
it's great for everybody. The emergency services, the individual involved, the emergency contacts, the family.
Yeah.
It really is. It's great. Hugely proud to partner with them.
Yeah. Yeah. And which is another way of getting PHA into the community, isn't it? And
absolutely.
enhancing and empowering their decisions. This is wonderful. I think after the 3rd of December, we'll come back and see how this wonderful organisation's growing.
That would be amazing.
How many more hubs there are in the first stages of creation as a result of that.
Absolutely, yeah.
That's exciting.
It is, definitely. And I don't know if you noticed. In fact, I think Pollyanna may have filled out a commitment card when we were at the festival. So on the website, we do have, under the Connect the Dots initiative, a commitment card that you can fill in online. We were doing them with a good old pen and paper when we were at the festival. But it was really that first step for people.
Yeah.
Make a commitment. Firstly to yourself, but then to your community to do something.
Yeah.
So I want to see everybody that made a commitment or is still thinking of making a commitment out there on the 3rd of December.
Yes.
Actually making it a reality.
Wonderful.
That's exciting.
Wonderful. It's all about the followers, isn't it? Once it's been established, it's all about the followers.
Definitely.
And people will follow the followers.
Yeah. Yeah. And do it for themselves.
Yeah.
That was it from the beginning. It's for the people, by the people, not for the people, by PHA.
Yeah.
Who happen to be 5 or 6 of us juggling far too many plates and spinning them and juggling them or whatever we do with them. It's by the people.
Yeah.
So come on, people.
Yeah.
Let's come together. Let's do it together.
Wonderful. Thank you for coming down today.
Thank you for having me. It's been lovely.
Yes, I've enjoyed it.